Hello everyone, my name is Aman and I'm a final year medical student studying at Cooper Hospital. So let's talk about USMLE and the most important thing that you should understand about USMLE. Okay, so when you're about to give an exam, the first thing that you should do is to study what the exam actually wants from you. Okay, this USMLE journey is a very different thing, not like your normal examinations where you go, you give the exam, you get some marks, and based on your ranking in that marks you get a seat. But here it's not that case, it's very much more complicated than that. So let's first understand what the USMLE actually entails, right? What's the main thing that you want to achieve in this exam, and then when you understand that thing you can work towards it. So in case of USMLE, it all boils down to the match. So the match is a process where the program directors in the USA, they will put out a list, okay, and in that list, if your name is there, number one, and if your name is higher up in that list, okay, then you have a chance of getting into USA for residency. So your whole motto in this USMLE journey is to first get into that list, right, and secondly be higher on that list. Now how do you achieve that? Okay, so the most important thing that you need to realize here is that that list that they are going to make is subjective in nature. It is not objective. Okay, this is very important. It is subjective. It is based on their own interpretation. Okay, so if the program director likes you, basically, okay, so you will be on that list, he will put you on that list, and he will put you based on how much he likes. You know, you can be higher up on the list if he likes you very much, you can be lower on that list based on his own preference. There is no objective criteria here. Okay, so you need to understand very clearly the main motto that you have throughout this whole journey is to be in favor of that person who is going to put you on that list. Okay, now how do you achieve that? You know, how do you make someone trust you? Basically, that's the thing. So for that you need to get LORs. What is LORs? So basically what you do is, before applying for this match, you go to USA, okay, you get some training under a specific doctor, and after you finish your training, you ask that doctor to basically vouch for you. Okay, so he's gonna write a letter for you, okay, stating how great you are, what all things you have done, why you will be perfect for this residency spot. So your main aim throughout this journey is to get a great letter of recommendation. That's it. That is your main aim, because at the end what's going to happen is that you will get a great letter of recommendation that is going to go to the program director. The program director will recognize the doctor who has written this letter of recommendation. You know, basically how it works is that a person from USA is vouching for you, okay, and he is saying that you will be a great fit for this program, right, for this residency. So in this way, they first of all get a reassurance. Okay, this person knows how to do some stuff. Okay, he can manage living in the USA because he has completed some experience here. Secondly, the reputation of the doctor who has written a letter for you is on the line now, right? So through internal connections and internal talking and stuff, you would be at an advantage. Okay, so now that you know that a letter of recommendation is the main thing that you have to focus on, now the question arises, how do you get the best letter of recommendation? For that you need to have, number one, a great score. You know, now you don't have to really worry because step 1 is pass fail, so you just need to pass step 1, and that is important. You know, once you have completed your step 1, you would be able to apply to much broader range of institutes in the USA for going for clinical rotations. This is very important. You know, before passing step 1, you are allowed to go and attend different clinical rotations, but you won't be able to get the competitive ones, you know, the ones that will fetch you very quality LORs. So first thing that you need to do is to finish off your step 1, okay, and then secondly, you can participate in research activities. You can try connecting with the people who are already there through some website of that hospital or through LinkedIn or many other places. You know, connection is the most important thing here. You know, you need people backing you. That's basically the thing. You know, the program director who is sitting there, he needs to know that you would be the perfect match for here. Somebody from the USA is watching for you. That's the thing he needs to know. Okay, so in order to get the best letter of recommendation, this is what you need to do. Get good ranks. If you have completed your step 2, that will be great, because now you have now they have one less thing to worry about. You know, if you have completed step 3, then though you don't really have to worry about that, because it's very easy for you to go and work there. If you have completed step 2 and you have a great rank, you know, you can go and do your clinical rotations in premium institutes. You know, they will select you easily and you can go and get a great letter of recommendation. So the strategy to get a great letter of recommendation is to go and proactively participate in things, you know, follow very clearly the things that are being shown to you, to do each and everything very in a very standardized way, yeah, and to get basically in favor of the attending or the consultant then. So try to get a letter from a senior consultant. That's very nice. That will be very good. A person who really trusts you, who has seen you work, you know, who can write a very genuine letter, not the repetitive ones, you know, because they get the students every year. You know, some or the other person is coming for clinical rotations and they have to write letters again and again. So go there and show that you are really interested in that specialty, you know, and you can really connect. If you already have people like your parents or someone who already have good connections, then though it's very easy, and many people get in through this route also, as I said, because it's very objective. But what you can do from yourself is this, you know, show that you are genuinely interested, show leadership skills, show that you have extracurricular hobbies, build a great CV, you know, and get good grades. So the first thing that you will do is get, number 1, good grades, or at least first finish off step 1. So you have your pass on step 1, one less thing to worry about, and much more areas to apply for your clinical things. Now, a very important thing to remember here is that you can apply for this clinical hands-on clinical experience only before you have graduated. After graduation, you cannot apply for hands-on clinical experience, because in order to get hands-on clinical experience, you need to be there as a training person. You know, you cannot be a fully qualified doctor. Whereas once you have graduated, you know, you have completed your MBBS degree, now you are a fully qualified doctor. Now you are not eligible for hands-on clinical experience, and this is very, very, very important. And this is the reason why there are people who have completed their steps, you know, they have also achieved good marks, but they are not able to get into residency simply because they don't have clinical experience, okay, and they don't have anybody vouching for them. So you have to be very, very clear on this, okay. You have to finish off your clinical rotations before your MBBS, very important. So complete your step 1 as soon as possible, okay. And after that, finish off your clinical rotations, hands-on clinical rotations, get your LOR, and then finish off your step 2, and then you can participate in match, okay. You don't have to complete step 3, you can give that afterwards, it's fine. So this is a very, very important thing to keep in mind. Yeah, let's summarize the whole thing. You understand now that this journey is subjective in nature, okay, it is not objective. The main thing that you have to do is get a great letter of recommendation. You need people backing you. That's the main thing that you need, okay. Now there are many different ways to achieve this, which I have already discussed, you know. Now let's talk about what if you have already completed your MBBS, you know, what to do now. So in this case, you can go for something known as observership, where you will just go and shadow a doctor. Basically, you will be alongside a doctor, you will be taking rounds and stuff, but you won't be touching the patients. In this way, you can go and build connection with the doctors and maybe get a letter of recommendation. The other way is to go for research positions. You know, if you want to get into very competitive fields, you know, there are people, what they do is first get into clinical research, you know, go and do research. Sometimes they are paid, sometimes they are not paid, but that's the price that you have to pay. The return on investment is really high, and it's the best in case of USA. So you have to put in something from this end. So remember, okay, there are different ways. The main thing is you need to get a great letter of recommendation, and how you achieve that is up to you. The most common way is, yes, through LORs, through clinical experience and stuff. But if you can do connections, you know, go to different workshops, talk with people, build up your connection. There are other ways to get into favor of somebody and have somebody watching for you. So this is the main thing that you need to understand. There are many people who have completed USMLE but cannot get a residency position because there is nobody watching for you, or they don't have great letter of recommendation. There are people who have got very bad scores, no, or even average scores. I should not say very bad, because as an international graduate student, you are expected to have a good amount of score, because there are many students, local students, US students, who are applying for that position. So if you want to stand out, you need an above average score at least, and that is doable. That is very, very doable. You can easily do that. Not easily, but you can do that. But the most important thing is you need people backing you. That's the most key essential thing. Most people, when they talk about it, they just breeze through this clinical rotation stuff. It's like yeah, this is very important, this is like the most important thing, but I just breeze through it. This is a short thing, yeah, I went in there, and this kind of thing. Don't do that. Okay, be very focused on this thing. This is the thing that will determine whether you get a residency spot or not. Okay, so once you have that in mind, okay, remember this clinical residency stuff, observerships and hands-on experience stuff, this has kind of become a business now. If you go to different websites, for clinical rotations and stuff, they literally offer, like, they literally say you will get letter of recommendation at the end of this thing. Okay, you just have to pay us money. So this has become a very big business, simply because of the fact, because this is the most valuable thing. Yeah. So, but don't get into this trap. If you do observerships, it has to be something genuine. The letter has to be like it has been written by the heart from a person who really trusts you, or else the program directors can easily see, okay, this is a very generic letter. It doesn't have much value. Okay, so spend good amount of money on this, but spend on the right things. Don't go for virtual observerships. Those things are a waste of time. Don't do that kind of stuff. Do real hands-on stuff. Do clinical research. Do observerships. As of now, this is the situation. I don't know what's going to happen later. This is a situation right now. Maybe later down the line, virtual observerships and stuff, they might be good, or they might be actually useful. So you got the entire gist of what to do, what not to do. Yeah, what is the most important thing. With that being said, I hope all my USMLE folks find some help from this. If you know somebody who is giving USMLE and doesn't really understand the importance of this thing, do send them this video. And yeah, that's it. I hope you all clear USMLE goals. And yeah, very important thing, this clinical rotations and stuff, these are actually very, very expensive, and this is the reason why many of the people are not able to go, because they won't be earning much money at this point. They are not earning any money during their MBBS days, and even after MBBS they start earning some money, but at that point you cannot go for clinical rotations. So yeah, if you have the kind of money, plan ahead. Don't be the person who has completed all the steps and then remember, okay, I don't have money for this. That should not be the case. Okay, plan ahead, have a good amount of money. Yes, you will make back a lot of it, but initially you do need a good amount of investment, especially premium institutes. For doing clinical rotations, they ask for thousands of dollars. Harvard and stuff, you can go and look into it. It's a great business. Yeah, but yes, the letter of recommendation that you generate from there, it has that much value. That's the reason it has so much value attached to it. So that's it. That's all from my side. I hope you find this video useful. Yeah, and whoever is doing USMLE and stuff, I hope you all go through it, especially my Indian folks and all international folks. Bye bye. Okay, I don't want you all guys thinking that scores are not important. They are absolutely essential. They are the second most important thing in this journey, simply because there are a lot of applications coming for USMLE. Okay, so the program directors, they basically use scores as a filter. So if you don't have a certain threshold of scores, you won't even like come into the radar of the people. They will just straight away reject your application, because there are so many applications and the spots are limited. So you need to get a good amount of scores, and especially even better than the people who are living there in the USA. You need to show that yeah, you have a bit more caliber than them in terms of score, or at least you are at par with them. So that is actually very important. You need to at least cross the threshold for that particular specialty. You can look up the competitive specialties have a higher threshold, whereas the less competitive has a lesser threshold. But try to get as better marks as you can, because that will definitely help you a lot. Okay. Yeah, scores are important. Don't tell that I'm telling scores are not important at all. They are the second most important thing. First thing I've already mentioned. Okay.